Osteoarthritis in Old Age. Understand, Prevent, and Thrive. A Journey of Joint Health with Dr. Dale Brettisson. Over 50 years of clinical experience. Welcome, everyone, to the Healthy Aging Program. I'm Dr. Dale Brettisson, professor and rheumatology specialist, with over 50 years of experience caring for elderly patients living with joint pain and stiffness. While most people think of joint pain as a normal part of aging, few realize how deeply osteoarthritis can impact quality of life, independence, and even emotional well-being. What exactly is osteoarthritis? Why is it so common in older adults? And how can you recognize and manage it early? Today, I'll walk you through each key aspect so you can truly take charge of your joint health. Understanding osteoarthritis and its hidden complications. What is osteoarthritis? Osteoarthritis is a degenerative joint disease where cartilage, the smooth cushioning at the ends of bones, wears away, leading to pain, stiffness, swelling, and reduced mobility. It most commonly affects the knees, hips, hands, and spine in seniors. X-rays may show narrowing of joint spaces, bone spurs, or irregular joint surfaces. Why is osteoarthritis called the silent burden? Symptoms can start gradually and be easily ignored: morning stiffness, mild discomfort, or fatigue after activity. Over time, joint pain can flare up more often, making walking, climbing stairs, or even daily self-care more difficult. Left unaddressed, it leads to loss of independence, muscle weakness, and risk of falls. Real-life examples. For example, a retired woman who slowly stopped gardening and meeting friends because of worsening knee pain, only to realize months later that her world had shrunk due to untreated osteoarthritis. Causes and risk factors in the elderly. Aging and cartilage wear. With age, the cartilage in our joints naturally becomes thinner and less resilient. Everyday wear and tear from decades of movement, combined with minor injuries, speeds up this process. Joint overuse and injuries. Repetitive movements, kneeling, squatting, heavy lifting, or old sports injuries increase risk. Occupations or hobbies that strain the same joints accelerate cartilage breakdown. Excess body weight and inactivity. Being overweight adds extra stress to weight-bearing joints like knees and hips. Lack of regular movement leads to muscle weakness, which further destabilizes and wears down joints. Genetics, other diseases, and female gender. Family history of osteoarthritis, previous joint infections, and conditions like diabetes or gout increase risk. Women, especially after menopause, are more likely to develop osteoarthritis. Early recognition and warning signs. Subtle symptoms. Morning stiffness, lasting less than 30 minutes. Mild joint pain with activity or slight swelling. A grating sensation, clicking, or crackling when moving the joint. Red flag symptoms. Seek medical care. Persistent joint pain or swelling, especially if it interferes with walking, daily activities, or sleep. Sudden joint locking, severe loss of movement, or visible deformity. Signs of infection, fever, redness, heat, or intense pain in a joint. Home monitoring and joint self-checks. Track when and how often pain occurs. Recording a joint diary helps your doctor understand your pattern. Pay attention to how pain or stiffness affects balance, walking speed, and hand function. Joint-friendly nutrition for osteoarthritis. Maintain a healthy weight. Even a small weight loss can reduce joint load and ease symptoms. Each kilo lost takes up to 4 kilos of pressure off the knees. Anti-inflammatory foods. Eat more oily fish, salmon, mackerel, sardines, avocados, olive oil, walnuts, flaxseed. Include colorful fruits and vegetables, berries, oranges, leafy greens, bell peppers. Calcium and vitamin D. Dairy, soy milk, tofu, sardines, and green leafy vegetables help maintain bone strength. Spend some time in the morning sunlight for natural vitamin D. Limit processed foods and sugar. Cut back on fried foods, red meats, sweets, and sugary drinks, which worsen inflammation. Sample daily menu. Breakfast, oatmeal with blueberries and walnuts. Lunch, grilled salmon, steamed broccoli, sweet potatoes. Snack, yogurt with chia seeds. Dinner, chicken and vegetable soup, side salad with olive oil. Safe physical activity and joint care. The importance of movement. Gentle, regular exercise keeps joints flexible, strengthens supporting muscles, and reduces pain. Best activities for seniors: walking, cycling, swimming, tai chi, water aerobics, chair yoga, and stretching routines. Short, frequent sessions are better than long, strenuous workouts. Exercise principles and joint protection. Warm up with slow stretches before any activity. Use proper shoes, assistive devices, or braces if needed. Avoid high-impact sports or movements that twist, bend, or overload sore joints. Rest and use ice packs after flare-ups. Medications and pain relief. Use and precautions. Main groups of medications: acetaminophen, topical creams, NSAIDs, with caution, or prescribed slow-acting drugs. Sometimes your doctor may recommend joint injections, corticosteroids, or hyaluronic acid. Medications and pain relief. Use and precautions. Main groups of medications: acetaminophen, topical creams, NSAIDs, with caution, or prescribed slow-acting drugs. Sometimes your doctor may recommend joint injections, corticosteroids, or hyaluronic acid. Monitoring and alternatives. Keep a medication diary to track relief and side effects. Ask about physical therapy, massage, acupuncture, or gentle heat therapy for added comfort. Daily habits and home strategies for joint health. Home safety and fall prevention. Remove tripping hazards, install grab bars in bathrooms, use non-slip mats, and ensure good lighting. Joint-friendly living. Use cushioned seats, raised toilet seats, jar openers, and reachers to reduce joint strain in daily life. Emotional well-being. Stay socially active, join senior clubs, support groups, or take up creative hobbies to keep your mind and mood strong. Dear friends, osteoarthritis is not the end of independence or joy in old age. With the right knowledge, proactive self-care, and the support of your healthcare team, you can maintain joint health, stay active, and live life to the fullest. Remember, every step you take to care for your joints is a step toward freedom and self-love. Wishing you and your family strong, pain-free years ahead. I am Dr. Dale Brettisson, always honored to support you on your journey to healthy aging. Next to them, a bold red subscribe button and a big like icon are displayed. At the bottom, a friendly caption reads, "Don't forget to subscribe and like to support our channel. Wishing you health and happiness." The overall vibe is positive, warm, and encouraging.